Brain attack or stroke is an emergency condition. Any unfortunate event that the brain attack happens, please do not neglect saying that it can be treated later. So much of advancement has taken place. If a victim reaches within the 3 hours after the onset of the stroke, a lot many things can be done to dissolve the blood clot, so that brain gets back its circulation as much as possible and as early as possible. It is possible today with the modern drugs called thrombolysis. We can dissolve the clot in the blood vessels if person arrives to the stroke center within 3 hours. If beyond 3 hours, we have other methods like endovascular treatment, thrombectomy, mechanical thrombectomy, where the clot can be removed and restoration of the blood supply to the brain can be achieved. The longer is the delay, more is the damage to the brain and more permanent is the disability. And time taken to recovery also depends upon the time of intervention. Earlier we diagnose, earlier we intervene, earlier is the recovery. So, the time is the brain, and the crucial time of first 3 hours is called golden hour. So, the medical treatment essentially consists of immediate diagnosis by doing a CT scan to identify what type of brain attack it is, and then introduction of a treatment, a medical treatment first, followed by an interventional treatment, and the second thing is the critical care management in the acute phase to protect the brain and minimize the brain damage. Later, once they come to the ward, we institute a long term treatment, adjust the medications, control all the risk factors, correct all the comorbidities that are associated, and initiate rehabilitation therapy so that he recovers completely and gets back to the society as normal as possible. There are certain situations where we need to do surgeries. The number one is that whenever there is a brain swelling following a brain attack or a stroke, we need to do a decompressive craniotomy. It is an absolutely life saving procedure. Endovascular interventions where we can control the bleeding, remove the clots, remove the put some devices so that the blood circulation is maintained to the brain. And like coronary artery stents, carotid artery stents can help sustain the blood flow and prevent the occlusion of the vessels that supply blood to the brain. Similarly, an endarterectomy where we can remove the blood clot located within the carotid artery that supplies the brain. It can be a floating thrombus or a permanent thrombus that can be removed and the blood flow can be restored. And last but not the least, like the heart, we can do a bypass surgery to the stroke patients, which is the long term where there is a blood vessel that is supplying to the brain is permanently closed. Then we need to create an alternate blood flow to the brain so that the recovery of the paralysis can happen gradually, and also a prevention of a second stroke within the same individual over a period of time.